What's up, guys? Doc Brown here, doing a Mascal video. This will be real quick. We're going to do more of it when we get to Rylea. Definition is the number of injured outweighs the medical assets. We do triage in a specific way. We use IDME, which is intermediate, delayed, minimal, and expectant. Expectant means they're pretty much dead and you can't save them without extreme intervention. Triage is the process in which we prioritize the patients. So as we can see here, intermediate is life, limb, or eyesight. Delayed is less risk to lose life or limb. And then minimal is the walking wounded. So if you just have like a little scratch. And expectant, only complicated interventions will save this person. You can also use colors to identify what's going on. So for intermediate, excuse me, you can use red for delayed, you can use yellow, minimal, green, and black for expectant. Moving down to our evac. For evac purposes, we're going to use urgent, priority, routine, and convenience. Urgent means they need to get going as soon as possible, no later than 2 hours. This is going to be your cardiac issues if they're unresponsive and burns between 20 and 85% of their body. Priority is 4 hours or they get worse. Then they can move up into urgent. There's going to be your closed chest injuries and brief unresponsive periods and fractures. Your routine is going to be within 24 hours, and it's going to be abdominal injuries with no decrease in blood pressure. It's also going to have your eye injuries and your spinal cord injuries. And convenience is just whenever you can get them. This would be like your expectant category, as well as your simple fractures, psychiatric issues, and terminal patients. The way things go out, you're going to get notifications by phone, radio, military police, a big bang and smoke, like an explosion, or a sudden arrival of large amounts of patients. The treatment commander, this would be more specifically in a hospital, but the treatment commander would initiate the Mascal plan. For us, it would be Cap Mullins. Bed board, this is going to be how many beds you have available. If you have a ward, is going to be your ICU and med-surg type things, type floors. How many beds are operational, which means how many are actually allocated, how many beds are occupied, how many are available. The availability and operational are almost the same. It's just more of, how many workers do you have to assist those patients, and keep this updated at all times. This is what your patient board is going to look like. Anytime somebody comes into the CCP or hospital or whatever we're going to end up using, we need to make sure we're tracking all of our patients. Mascal patient number 1 through however many is going to be there, their name, whether they're civilian or military, current location. So the I would be in the in immediate section, and disposition. So that's going to be what they need to go as. In this case, would be urgent. So down here, we've got our little building, and you've got our Mascal patients over here. This person here is going to be the one that is in charge of your triage. So they're going to be typically the most experienced person available. Then you have your recorder, which is going to do your patient board. And then you have your different sections. So minimal, delayed, expectant, immediate. Your immediate is going to be where the majority of your medics are going to be working. You can have one of these guys come over into delayed if need be, just to check up on people, that kind of thing. Excuse me. Anybody that's in your minimal category can come down here and help with the expectant category. Again, these are going to be the guys that are not doing so hot. They're probably going to die. And the minimals can help with both the expectant as well as these other two sections to try and help alleviate the medics. If you have a chaplain available, this is probably where your chaplain's going to be at. This guy at the back of the building, or your CCP, is going to be in charge of saying who's ready to go out into the helipad when the helicopters get there. Then you're going to have your other guys. So these guys are going to be your litter teams. They're going to go out. They're going to pick up a patient. They're going to bring him in, say what's wrong to the guys at the front door, and then the front door is going to tell them where to go into each category, and so on and so forth, while recording who it is and where they're going. That's all I got for now, guys. Have a great day. Talk to you later.